Say we are the largest closed medical scheme. We cover over 2.3 million beneficiaries. We need to understand what the healthcare needs are. We need to understand the health status of our beneficiaries. So effective coverage is all about really measuring ourselves in terms of the effectiveness of the healthcare cover that we deliver. And there's various ways of doing that, understanding the healthcare needs, understanding if the services and the benefit offering that we provide to our members speaks to their need. Is it effective? Are we creating access? Are we achieving better outcomes by collaborating with treating healthcare providers like doctors, GPs, hospitals? So it's all about making sure that we look at what's working, what's not working, and make sure that we improve on where we're doing well, and have interventions and ways of doing better where we're really not effectively managing the population of our beneficiaries.
Which areas would you say you need to improve on? Because most of the time, beneficiaries of medical aids will complain about not getting the services that they want from their medical aids. According to James, which areas would you say you need to improve on?
So I'm going to point out two areas. So what we have seen, and this is an industry trend, what we have seen post-COVID is that there has been a rise in mental health admissions and mental health diagnoses. So mental health is an area of focus for us to make sure that first the comprehensive cover that we provide is available to members and accessible to members. Secondly, I think one of the things that we always encourage our beneficiaries to do is to understand the cover. There's various options, right? So you have to understand the cover that will suit your healthcare needs. So if you go for the lowest cost option, and you have certain healthcare needs that are not really suitable for that option, then it's going to cause you to have out-of-pocket payments. You have to understand that there's contracted service providers where members are protected against out-of-pocket payments. So I think what we really drive and we encourage our members to do is understand your benefits. Call us, ask questions, and get advice from our client liaison officers in terms of what option is best suited for you and what services you have available.
Soon, South Africa is going to mark a breast cancer month. In the past, removing breast was regarded as cosmetic. But we now know that breast cancer is something that is very serious, and there is a high prevalence of breast cancer among South African women. As James, what's your position on that?
So you asked me one of the areas where we need to improve, access to preventative care and screening. So we struggle a lot to get people to go for screening tests like mammograms, for example. We're talking about breast cancer. It's very important to go for your annual mammogram. We want to catch these conditions early so that then the interventions can start early. So one of the other areas is, I would encourage all women above 40 to please go for your annual mammogram. We provide cover for annual mammograms, and it doesn't come from your day-to-day benefits that you can use whenever you need to. It comes from what we call the risk benefit, so it doesn't affect what you need to use out of day to day. So I would really encourage women to first know how to examine your breast, right? You need to examine your breast every month, but also every year go for your mammogram.
There's also prostate cancer, which is prevalent as well among men. On that one?
Same. Go to your doctor, get screened, especially if you're a male above the age of 55. These services are available, and I said all of them are available from risk benefits because we want to encourage people to go for these tests. So go for your annual testing and contact your GP and get all the tests that you need.